Hello future doctors, welcome back to the Happy Teeth Club. Please subscribe to the channel. So in this video we will learn about developmental disturbance of jaws. So the topics are agnathia, micrognathia, macrognathia, facial hemiatrophy and facial hemiatrophy. First is agnathia. A means absence, gnathia is something related to jaw. Here you can see abnormal positioning of ear. It is an autosomal recessive, complete or partial absence of maxilla or mandible. Prognosis is very and is lethal. There is abnormal position of ear. In agnathia of maxilla, maxillary process absent or premaxilla absent. In agnathia of mandible, entire mandible absent, either ramus absent or condyle absent. Now what are the causes? Failure of migration of neural crest cells into maxillary prominence at 4 to 5 weeks of gestation. Now micrognathia. Micro means small, gnathia is something related to jaws. It is of two types, pseudomicrognathia or true micrognathia. True is of two types, congenital and acquired. Here you can see the jaws are small, so it is micrognathia. In pseudomicrognathia, here you can see smaller jaw because of illusion. The jaws are of normal size but it appears to be small. So why jaws appears to be small? It is either due to abnormal position, abnormal relationship of maxilla to mandible and abnormal relationship to maxilla to skull. Now congenital true micrognathia. A very important syndrome, that is Peary-Robin syndrome, is associated to it. Now acquired is due to trauma, infection and ankylosis. Micrognathia of maxilla. There is a deficiency of premaxilla. What are the clinical features? There is always mouth breathing and retracted middle 1/3 of the face. You can see in the picture. In case of mandible, severely retracted chin is seen. Here you can see mouth breathing and severely retracted chin. So in case of etiology, there is a trisomy of 13 and 18 chromosome, Turner syndrome, Marfan syndrome and of course Peary-Robin syndrome. Next topic is macrognathia. Macro is large, gnathia is something related to jaw. There is true type, true and etiology, pituitary gigantism, Paget's disease, acromegaly and also it is hereditary. Now clinical feature, mandibular protrusion, gummy smile, excessive condylar growth and prominent chin. Causes of mandibular protrusion. Mandible is more larger than maxilla. It can be due to increased angle of ramus and body, increased ramus height and anterior positioning of glenoid fossa. Next topic is facial hemihypertrophy. It is also known as hyperplasia. It is rare, asymmetrical and overgrowth of one or more body parts. So what are the clinical features? Females are more prone than males, involve the eyelid, cheeks, lips, facial bones, tongue, ears and tonsils. It is more common on right side of the body. It is unilateral enlargement of facial soft tissue, bones and teeth. Here you can clearly see in the picture. There is unilateral macroglossia with an increase in the size of fungiform papilla is seen. There is enlarged dentition and early shedding of deciduous teeth. Now facial hemiatrophy. For this you can check playlist syndrome. Thank you so much.